Hello, doctors. Today I will be discussing the treatment of acute suppurative otitis media. This is a very common middle ear infection, especially in children, and it often follows an upper respiratory tract infection. And this is a very common question in AMC MCQ. The treatment part is very important, and sometimes it's very confusing, like where we should start the treatment and where not. So I will discuss the management in a very short, and we'll try to solve the confusions. We all know what the patient will present to us. The patients usually present with ear pain, fever, hearing difficulty, sometimes ear discharge if the eardrum perforates. So let's discuss the management. Most cases of acute otitis media in children resolve spontaneously. We need to remind this point very clearly. And antibiotics are not recommended. So it's very important to remind that antibiotics are not recommended in most of the cases. So, how will we treat the cases then? We can treat the patient with simple or adequate simple analgesics. So, at first, we need to see the red flags. So, what are the red flags? Patient who should be considered for immediate treatment with antibiotics. This group are if the child is less than 6 months old, if the child is immunocompromised, if the child Aboriginal or Torres Strait Islander children, or only hearing ear. If one ear is present which is involved in the hearing process, or the child has a cochlear implant, if possible, or possible suppurative complications. So these are the red flags. Before starting the treatment or consider the treatment of acute otitis media, you need to look at these points. So at first we will see if the child is mildly unwell or is there any red flag. If the child is well and there is no red flag, you don't need to give the child any antibiotics for the first 48 hours of symptom. You will give the child only analgesics. Then you will see after 48 hours if the symptoms are improving or not. If you see that the symptoms are improving, you will advise the parents to seek medical review if there is any ear symptoms or hearing difficulty or persistent irritability after 2 to 3 months. So this is the simple type of management where there is no red flag and the child was well. Now come to the management where we see there is a presence of red flags and the child is unwell. So what will we do at that time? We will give the child analgesics, and now at this point of time we need to start antibiotics. So what is the choice of the antibiotics? This is amoxicillin. For how many days? For 5 days. Now we will again see the patient after 48 hours. If we see that the patient is improving after 48 hours, we can discharge the patient or ask the patient to review these things. But if the patient is not improving in 48 hours, we need to consider alternative diagnosis. If none, then we need to switch amoxicillin or clavulanic acid for 5 days. So this is the treatment approach of acute otitis media. If you need to know anything, please let me know. Thank you.